Hola amigos, ¿qué onda? Welcome back to another edition of Lucha por Lucha. I'm Alvaro Riojas here with the lovely
Mel Riojas.
and we are back, ladies and gentlemen. We were on hiatus for 2 weeks. Just things are getting really busy around Cinco de Madre. The date is coming around the corner, and we've had some other events that we've been a part of. But I'm very excited today to talk about men's mental health and the importance of recognizing signs and symptoms and ways to seek out help. I have with us today a very special guest. He has helped me on many occasions. He's always there for me. This is Dr. David M. Reiss, MD, psychiatrist.
Woo!
Glad to be here.
Welcome, doctor. Welcome. Doc, it's something that we've been wanting to do for a while. We've been wanting to discuss men's mental health. This is something, it's a new chapter in my life that I've really began to explore recently. Why do you think it is that guys like me have trouble, finding the help or seeking the help?
Yeah, there's always been a hesitance on the part of men to admit problems. And it crosses cultures, most cultures, but also in the workplace and in various different fields, particularly in sports, but in other areas also. And it just doesn't come naturally for a lot of men to talk about their feelings or to seek help if they're dealing with something uncomfortable.
Now, is this something that you've always been interested in, the mental health side of things?
Yeah, well, I mean, my background's a little bit different in that I started out in engineering way back. I won't tell you how far back. But I went from biomed engineering to med school. And once I was in med school, I knew the only area that I might be interested in would be psychiatry. So I've always been sort of philosophically oriented and psychologically oriented. But it was in med school that I got into psychiatry. And my first sports medicine was actually during medical school with the Northwestern football team of 1977.
Oh, wow. No, hey, that's a good year, I've heard. And Doc, you're joining us right now. You live in California. What part of California?
I'm in San Diego.
San Diego.
I've been in San Diego for almost 30 years now. Yeah.
The 619.
Yep, six. Now we're 858, but I had 619 for many years.
So, do you think that Rey Mysterio is going to have to change the name of his move from the 619 to the what was it, 818?
The 858.
858.
Actually, Southern San Diego, I think is still, and Central San Diego, I think is still 619.
Okay.
I'm on the northern side. We changed over a number of years ago.
Oh, wow.
So he could keep it.
He could hold on to it. All right.
Right. And I'm not going to try to duplicate it.
No, that's a very complicated move. I wouldn't even attempt it myself. Now, it's interesting. My wife, she's a psychology major, and she's really involved with podcasts. She listens to a lot of podcasts dealing with mental health, and we have long discussions. I think I'll open the floor to you, babe. See if you and the doc can,
Oh my gosh. Well, I think one thing I've noticed is a lot of people, their version, I guess, of vulnerability is opening up about things that they've dealt with, things that they feel even, things that they'd like to work on. But I think that's kind of where it stops. They kind of just, they have trouble taking the leap of actually seeking the help and talking to someone about it and bettering themselves. I feel like a lot of men kind of stop there.
Yeah.
How can we encourage them to take the next step?
Yeah, I mean, that currently people are somewhat more comfortable talking about what they're experiencing in the present, but for various reasons, both personal reasons and part of the system, doesn't really encourage people to look inside to what's going on, to connect it with things in the past, and to really get a broader point of view. We've got much more to, okay, this is what I'm feeling, what medication helps, or just very simplistic behavioral ways of changing things rather than really looking at what's going on within me as a person.
Right.
Okay. One thing that I wonder often is, as psych majors or as individuals who have an education in psychiatry and psychology, does it come a point where you find yourself, diagnosing people, just random people that you meet on a daily basis, or even relatives that you're discussing, and you're thinking to yourself, I think you're dealing with this?
I guess psychoanalyzing.
Psychoanalyzing. There's a word for it. Okay.
Yeah, no, early on, yeah, you sort of pick up some of that, but then it's no, that's my work. And I have a standard line when I meet people socially, and they say, "Are you analyzing me?" or say, "Are you paying me?" Uh, Actually, seriously, you get to the point actually pretty quickly where you realize that's not appropriate. When you're dealing with someone socially or casually or at work, you just want to deal with the person. You're not there to be their therapist,
Yeah.
and that part of me turns off.
Okay.
Yeah, and one thing that I've really talked to a lot of my friends about is just how healing it's been to communicate with you, how healing it's been to recognize certain things within myself. And now the word that they describe me as isn't that I'm different or that I've changed. A lot of them have said that I've grown. Now, once somebody starts understanding and being a little more aware of themselves, like, what's the difference? Is it like night and day? Or what, in your experiences, like, what differences do you see in those changes?
I like to use the word evolve.
Evolve.
That we evolve to a healthier state, to a more comfortable state. Do we change who we are? No. Can with extensive therapy there be changes in personality structure or how you approach things? To some extent, yes. But the basics of who we are stay who we are, and our past remains our past. But we can certainly evolve, change, grow to a better understanding of it, a better way of coping with it, and a better way of dealing with it in the present. One of the things I tell people is, I don't do therapy so you could write a book about how screwed up I am, and I'm just as screwed up. I want to do therapy to, okay, I want to understand the past, but as it helps me in the present and the future.
Okay.
Something I'm noticing of what you said is kind of, I guess when we go to therapy, we realize we actually have more control than we like to think. It's not about changing the outside, but changing our inside and how we think, how we see things.
Right. How we see things and acknowledging to ourselves that we have unconscious processes that when you make it conscious, doesn't mean it just suddenly changes or goes away, but you can figure out a different way of coping with it. And you can realize that some of the things that you feel come naturally are coming from habit or coming from past trauma or experience, but not necessarily a place of wisdom. Sometimes it's just a habit or what we were trained, and not necessarily appropriate to the current circumstances.
And Doc, I think one of the things that I forgot to mention as we did the introduction was that you are involved with pro wrestling. And I had a question. How long has this relationship been going on, you and pro wrestling? Talk to us about that.
In terms of any relationship, I remember my father waking me up when my mother would go out to play mahjong. My father would wake me up to watch black and white TV with rabbit ears, and we're talking about Vern Gagne.
Oh, man.
We're talking about the late 50s, early 60s.
Was this in San Diego?
This was in New York.
New York,
City.
okay.
We watched Madison Square Garden. But in terms of my actually being involved with the system, it's sort of a long story, which I won't go into, but I've made connections through my work with the California Workers' Comp system with athletes, and that brought me into wrestling because I always had some interest there. I worked at a hospital in Massachusetts, which was across the street from a wrestling studio.
Oh, wow.
And for about 15 years, I've worked with just volunteer, basically, with Chris Nowinski and the Concussion Foundation. So it wasn't just wrestling, it's also football, even baseball, mostly catchers. But I've been involved with wrestling itself, and I've been a member of like Cauliflower Alley Club for close to 20 years,
Oh,
15,
wow.
20 years.
Do they still do their yearly? Yearly. They get together, right? And they have a performance, a show out there in Vegas. Is it?
Yeah, they have a yearly reunion. I mean, there wasn't always a show, but most years we would have a show.
Okay,
I actually haven't been there since the pandemic. Obviously, they
gotcha.
canceled a couple, but just scheduling, I haven't been able to make it since then. But yeah, they still. I think it's going to be in August this year,
Okay,
but it still goes. I've given some seminars there.
okay.
And actually, when I started with, which brings us to what you were talking about before, when I started with them, they were very hesitant to have a shrink talk because
Okay.
no one wanted to talk about mental health issues. You know, it's changed. It's a
Yeah.
lot better now. But that wasn't that long. It was maybe 15 years ago where I had to really tread carefully.
Okay. Yeah, and I know that. I mean, back in the day, it was all about that grit, all about that grind, and it was tough on people. Well, people were tough on people whenever they would talk about what they were feeling or thinking. And a lot of times, these wrestlers, both men and women, would hold things in, bottle it in. And I remember hearing about, when I was young, reading about the Cauliflower Alley Club in magazines, PWI, and things like that. And always seeing at the bottom of the paragraphs or articles that they would write about them, it would have the link to the website, accepting donations. And they help a lot of wrestlers who didn't quite have the great fortune as others did, with their careers in wrestling. I think that's a great thing that
Yeah.
they've always been a part of.
Yeah, and it's been difficult going back for two reasons. One, it was seen as a weakness, by other people. You're afraid that your peers are going to see you as weak, and the other thing is, in most sports, it was seen as a reason to push someone down on the roster. Whether you're talking about wrestling or football or baseball, someone mentions mental health, and their chance of making the first team decreases on the spot. Now,
Okay.
that's changed in most places, but that was a very real risk until relatively recently.
Yeah. No, and I'm glad that things are changing because, like I've said, I know it's done wonders for me and in my relationships, both with my family and with my peers who I work with, and even a lot of the local friends of mine who I do business with. It's really helped my relationships with them, and I've always encouraged, seek help if you need it, especially if you feel like it's overwhelming. Because a lot of times things are out of our hands, and as my wife mentioned, we have more control over this than we are aware. Ourselves
Yeah.
are aware. Then,
Yeah.
I did have another question, Doc. How
Sure.
can
Sure.
male wrestlers navigate the macho culture often associated with sports entertainment while still prioritizing their mental health?
Well, and I don't want to seem presumptuous because the only times I've been in the ring is to make announcements.
Yeah.
But in a way, it's the same way you handle your persona, or your character. There's a part of you that needs to present in a certain way in certain environments. But then there's the real you who needs to be real with yourself and with family and with others, and with close friends, and hopefully having close friends who accept that and there's a mutuality to that. So it doesn't mean you have to be open everywhere with everyone. I wouldn't suggest that. But to have places, and especially within yourself, where you can be open.
Okay. And I know that performing in front of a live audience can be, can cause a lot of pressure and so oftentimes anxiety. From your experiences, what impact does the audience have on these types of anxieties, and what can a performer do to get past them?
Uh, the audience has quite an effect because people want to connect with the audience. And of course, wrestling is very different from almost every other sport in that the performer has a relationship with the audience. The football player, yeah, may go out afterwards and do a news conference, but football player, baseball player, the hockey player isn't really looking at the audience when they're trying to score a goal or when they're trying to shoot a basket. So wrestling is very different in that way, and there's much more of an impact. But then in any sport, and not only sports, I see it with first responders, I see it with law enforcement, I see it with, all the trades that are macho, and macho whether you're a man or a woman, it's the same dynamic,
Yeah.
where there's a fear of appearing weak and the fear that the audience or the fan base will see you as weak. And thankfully, that's changing.
Doc, have you ever seen The Sopranos?
Yeah, sure.
Okay. I started watching it not too long ago. I guess maybe 2 years ago, and I did finish the seasons, finish the whole series, and I enjoyed it very much. However, I was very surprised that because this show I think started in the 90s and
Believe so,
late
yeah.
90s, I believe, like 98, 99. And, without spoiling too much, I mean, the main character, Tony Soprano, goes to therapy and he sees a therapist almost every episode. And I'm wondering if and how much it helped to show such a masculine figure as Tony Soprano being vulnerable. And of course, we did see moments where he struggled with that vulnerability. But I remember seeing those episodes. And at the time, I would speak with you. And we never really talked about the show itself. But I would kind of correlate my life with what he was experiencing as far as the feelings and having trouble with the vulnerability.
Yeah. No, I don't know exactly how much to attribute to that show, but certainly the media in general, movies, TV, because previously it was more people who were portrayed as weak, or as humorous, the Woody
Yeah,
Allen character,
gotcha.
the nebbish, and to see people who are strong people, and maybe too strong in some cases, uh, who still can acknowledge that they have issues has been very helpful. Yeah, and not across the board, but in general, it has been.
Okay.
I have a question. So a lot of these wrestlers that you see, what is maybe one of the biggest reason that they come to you? What are they
You know,
struggling with?
you know, Actually, it's pretty similar to any other population, with some differences, but it's pretty similar in that all sorts of issues. I mean, I have a lot of people, and has nothing to do with just my position now. This is across the board in terms of different organizations I've worked with, whether it was formally working or informally. People come with just anxiety and depression because that they just happen to have it. They don't know from where. Family issues, relationship issues. Obviously, there are also performance issues. And when you're dealing with any professional sports, job security isn't a real solid thing for most people. So, unless you're on the very top, there's always the anxiety of where am I going to be tomorrow or next year. Plus, when you're dealing with pretty much any sport, it's every time you're out there, there's a risk it could be the last time you're out there. There's the risk of injury and there's chronic pain. Like a lot of the athletes that I work with, I'll say, when was the last time you woke up and you weren't in pain? I'll say, well, sometime in high school. And that's not the response I get from someone who's an attorney
Right.
or, working at a desk job. So there are some very particular stresses, but there's also everything across the board. And that is unfortunately typical in all areas, a lot of histories of trauma, childhood trauma, teenage trauma. It's there.
And to piggyback on what she was asking, are there any specific mental health issues that tend to be more prevalent among male wrestlers? And if so, why? Why would that be?
Uh, I would say no. I mean, there are specific issues that come up, particularly like chronic pain, as I say, if
Yeah.
you're getting career. But in terms of underlying issues, no, they're people. They're people. And, uh, they're dealing with the same issues other people do. And, it took me a while, and this doesn't only pertain to my current job. This goes back to when I first started working with athletes and all, and particularly people who are on the professional level. But just to use wrestling as an example, someone will come and say, I really hate confrontation. And they're talking about their personal life and relationships. They say, did you see yourself Wednesday night? Are you really? But no, the real person, yeah, they can just be struggling with confrontation. They can be struggling with being assertive. It's every issue that anybody else deals with, plus the issues that are specific to the particular sport or the specific activity.
You know, you touched on something right now, assertiveness. That's a big one for me. Being assertive, being direct. I've recently in my life I've made certain changes with certain individuals where I've had to be more direct. I've had to be more assertive because I was allowing them to disrupt any peace that I had in my bubble, in my world, under my roof. You know, and I shouldn't have to be struggling with issues that someone is bringing to me when I can be assertive, be direct, and let them know how they're making me feel. And I have control of what happens, whether this person does or does not listen to me. And it's just a matter of speaking up, communicating. And that's something that's really helped me is being more assertive.
Yeah, and a lot of times, and this it goes across the board, not just athletes or wrestling. People feel they have to be in control of the other person. No, you can't control the other person, but you can control yourself, and you don't have to let the other person's behaviors or responses control who you are. And you can still stand up for yourself. And obviously, a lot of times it goes back to when we were kids and whether we were bullied or sometimes even being the bully, where we develop certain ways of relating that then, as adults, as parents, as spouses, it doesn't work well. We're not kids anymore. And we have to have a broader view and we have to stand up for ourselves more directly. And appropriately, not violently.
Yeah, of course.
Control,
Yeah.
but stand up for ourselves.
I think for me, it was, I would tell him, like, don't be passive aggressive. If you have something to say it. Like, spit it out. Because that was one thing. I think he wanted to keep things lighthearted. He kind of just wanted to be casual about things. And I just felt like that's bothering me because it's making me feel like I'm dumb. Don't talk to me like I'm dumb. Just if you have something to say, like, I'll hear you out. But I'd rather you just be direct.
Yeah. Because when you start responding, I mean, I don't mean you personally, when anyone starts responding in a passive aggressive way, you're basically gaslighting yourself. You're telling yourself it's not that serious. I don't have to be direct, or I don't have the standing to speak up for myself. So, you're basically attacking your own self-esteem.
Wow.
And that becomes a vicious cycle.
Yeah, and that is something. It's fun, not funny, haha, but it's funny you mentioned that because that's something I dealt with for a very long time. Self-doubt because I wouldn't speak up, and because I would really bottle a lot of emotions in. Resentment would grow, and I just wasn't very sure of myself. What I've learned from being more assertive and being more direct is that we can have hard conversations and we can get through them. It's not the end of the world. It's not going to be easy, but sometimes getting through these challenges helps us grow tenfold.
Yeah. And being assertive doesn't mean that you always have to be right. You have to be willing to be wrong and be willing to admit when someone brings up an issue and says, that's a different way of seeing it. Maybe I was wrong.
Mm-hmm.
And to be able to admit being wrong without losing self-esteem and see that as a sign of growth, a sign of openness, not a sign of weakness.
Yeah. Do you believe that being passive aggressive like that, do you think that's a learned behavior from childhood?
To a large extent it is, and obviously in different cultures, different environments, it's treated in different ways. But in general, especially in our culture here, women have been taught to be passive aggressive. Mm-hmm. Men have been taught to be passive aggressive in a different way. But we don't have a culture that's very open about a lot of feelings. We don't handle grief well. We don't handle mourning well. We certainly don't handle anger well. And, these are universal issues. I like to use humor because it puts things in context. If you really look back, Socrates and Plato were talking about some of the same issues, but they weren't tweeting about it. They weren't posting it on Instagram.
That's true.
But these are the same human issues that as long as we've been human, we've been struggling with these issues. And societies have been struggling. Some better, some worse.
Well, the mind is such a complicated thing. Like we as humans don't quite understand it as much as we would like to. and every day we learn something
Not
new.
even close.
No, not at all.
No, no, very true. We're very complex animals or whatever you want to call us. But a lot of times that's something that people underestimate. And even these days, in the big push for cognitive behavioral therapy, now, in my opinion, cognitive behavioral work is an important part of any good therapy, whether you're talking about just supportive counseling or even psychoanalysis. But it's not the whole ball game, and it can be too simplistic. Where we treat ourselves as if we're a machine. Okay, if I do this, if I change A, then B will change. It's not that easy. If you change A, it's going to change B and C and D and E, and they're going to interact with each other. And you're really dealing with a very complex, more of like a quantum system. And when we treat ourselves like machines, we end up acting like machines. And that's not much fun. It doesn't do well for relationships.
Going back to something you mentioned earlier, you mentioned Nick Bockwinkel. I'm very curious, Doc. So besides Nick Bockwinkel, who were your favorites growing up?
Oh gosh, I mean, it's funny because when I joined Cauliflower, I actually met Nick, not on a clinical basis in any way.
How was that for you? How was that interaction?
Very strange when you meet people. Especially when you happen to meet them in the restroom, then it's really strange. And I won't name the people that I met.
Oh, brother. Oh, man.
No, it is. But you get to see that there's a real person there, which doesn't take away from who they are in their professional life and doesn't take away from the awe for what they've accomplished. But you get to see them as real people.
Okay. Now, what have been challenges for you, Doc, working with athletes, not just in wrestling, but I mean athletes as a whole?
I'd say the biggest challenge is, really what you mentioned is that people are afraid, what if other people find out?
Oh, yeah. The
What if
stigma.
other people, and that's less so now, but basically the stigma,
Yeah.
And wanting to be macho. And again, that goes to women as well as men, wanting to appear so strong that they're not affected, as opposed to saying, I can be affected,
Yeah.
and then I can handle that response rather than being immune to it or just reacting behaviorally. So particularly with athletes, you see people who want to be in control, and there's nothing wrong with that, but needing to know when to let that down, and just being able to be off duty. I mean, I had to learn how to be off duty as a shrink.
Mm-hmm.
And being a celebrity, you have to learn how to be off duty. And that's tricky at times because the public won't always accept it.
Yeah.
I mean, you can see it even today on social media. Oh, this person, in real life, they weren't what. We never really expected James. If you met Sean Connery, you didn't expect him to be James Bond in real life. But we do expect that of athletes. We do expect that of the people we, see on the field of play.
Yeah, I mean, I can tell you as a woman, I know that I've met plenty of women who get turned off at the thought of a man who is sensitive, who will open up, who feels vulnerable. I had a close friend who told me that she got the ick when her boyfriend cried to her, and she felt like, what? Like, you're supposed to be strong. You're supposed to be the tough one. You should be taking care of me. You should be the caretaker. And I was mind blown at the thought that there's a lot of women who think this way.
Yeah, because the confusion, it's not that you don't want people to be strong. It's that strength is being able to try and do what's strong and correct anyway.
Yes.
To have the strength to be able to express the feelings, tolerate the feelings, and act in an appropriately strong way. It's not an either or, but we're sort of taught that it's an either or. And as you say, women more so to where you rely on the strong man. It just doesn't work that way.
Right. That's the other side of it's the other side of the patriarchy where you should have a partner who wants to hear you out and be there for you.
Right.
Regardless,
Right.
male or female.
And and who's willing to cry with you.
Right.
That's
Doc,
and
and
it's important.
and not to put my marriage or my wife over, too much, but I feel like when we met, it was so unique for me because she allowed me to be myself. She allowed me to open up, and I'm a very sensitive person. You could ask my friends whether it's, it could be, happiness, I'm sensitive, sadness, I'm sensitive, anger, I'm sensitive. And with her, I was able to really get a lot of these sensitivities under control in a very comfortable way. And she made that possible for me. And I'm very grateful for her. And through you, I've been able to really rely on myself to understand myself a lot better too. So I thank both of you at the at the same time.
You're welcome.
Thank you guys.
Yeah. Strength isn't a lack of sensitivity. Strength is the ability to tolerate being strong, being sensitive, and being able to know when you should be open and when it's best not to be open. But strength is being able to tolerate sensitivity, not the lack of
Oh,
it.
that's beautiful. That's true.
Now, Doc, how do you think that we can work to break down some of these barriers of the stigma, not just in wrestling, but with men's mental health?
I think just doing things like this, just talking about it, being open about it, and being real about it. Not putting some fake, you know, roles on it. I don't play psychiatrist. Sure, in my early years, I mean, for years I wore a sweater because Judd Hirsch wore a sweater when he did ordinary people. But no, it's not a role, it's real people. And I think the more that the public can just see people, whether they're heroes on the field of play, whether they're in the media, also being real while maintaining, doing their job well, is the best thing we can do.
Yeah, and you mentioned earlier, like it is tough. I mean, back when I was wrestling at a local level, but my mind was going 100 miles an hour, trying to find my way to the big leagues, trying to have my breakout moment. And my wife and I had conversations of, hey, maybe you need to dial it down a bit because there's things at home that need your attention too, and you're neglecting them because you're too focused on trying to make it. Things like that. Is that something that you encounter often? And if you do, what are the differences within the levels? I'm talking about indie wrestling up to, the pros.
And it's not just wrestling, and it's not just sports. I mean, I see the same thing in almost any field of endeavor where people want to turn into who they think they should be, as opposed to I am going to do this work or I am going to take this position, that I have to become someone I'm not. And obviously, the more insecurity that's inherent to the field, like in sports, as opposed to a desk job, the more pressure there is, and the more fear there is that if someone sees me as weak, I'm not going to get where I want to. But I see it all the time in basically every profession. I see it as I say, it as particularly professions where people like to have an edge, where people like to have a bit of adrenaline rush and be strong. And we're not talking only physically. I'm talking about doctors, lawyers, first responders. You know, it becomes very difficult, and people try to fit what they think they should be in terms of using who they are to be as good of a wrestler or policeman or doctor or lawyer as they can be, but still being a real person.
Now, I know that within wrestling, podcasts are a big thing. And you mentioned how this is one good way of breaking down these barriers within wrestling. And I ask this because a lot of our listeners are in local wrestlers and they're involved in wrestling. They're promoters, performers, all of these. What can we as promoters, wrestlers, and performers do to help break down these barriers? We have the podcast. What else can we do? What else can we try to do for?
I think part of it also has to do with storylines. If you want to get into wrestling
Yeah,
itself,
yeah.
that obviously storylines play into fantasies, and they should. That's what they're there for. but to be able to have the storylines where they go in different directions, where it's not always the same old storyline that worked in the 50s or the 60s or even the 80s and 90s, where there are vulnerable characters
Mm.
who are strong, who are effective, but have vulnerabilities. So I think we can incorporate it into sport, uh, as well as just, again, being able to be real when you're off the field of play or not in the ring.
Gotcha.
And that doesn't mean looking weak or looking, like inept. It just means looking real
And I think
and
that
just
comes
being a
from
real person.
that may come from a lot of insecurity as well, because I remember when I was a wrestler, I wanted to be the cool guy. I wanted to be, even when they asked me to be a heel, yeah, I had some ideas of how I can be a heel, but no, then I'm going to look like a coward. But then no, because then I'm going to look weak. Like then I'm going to look like I'm afraid. When in real life, when met with altercations, I'll be honest, my heart is beating 1,000 miles an hour. I'm not cool, calm, and collected. I am afraid.
Yeah,
I just show it
yeah,
differently. And then when we're performing, we have to be able to tap into that real feeling that we would get, I think. And it's a tough conversation to have, a conversation I've had with friends of mine, as far as don't just think about trying to be cool, try to be a little more real so there's a connection
yeah,
with the audience.
yeah, yeah. Because if you really look at it, a lot of wrestling storylines are about trauma and are about dealing with trauma. Now, I'm not going to say the solution is always the right one.
Yeah,
That's
yeah.
but no fantasy is fantasy is fantasy. But to be sensitive to that, and I had one person, I won't say what organization or when, who said to me, everyone expects me to be this strong man. A lot of times when I'm out there, I'm thinking, how could I be a good mother? What would a good mother do? And how do I incorporate that into the storyline? Because that's going to really connect with the audience more. Is to have a still be a strong man, but to have a maternal side, to be able to be kind as and not just in the service of being selfish, but to actually be able to show kindness, to be able to show caring, even within a storyline that's pretty tough.
And that's very interesting. It's very much the same as saying don't think so much about what it is that you want, but think about what's going to sell to the audience, what you're going to be able to sell to the audience emotionally in order for them to become emotionally invested. You have to
Yeah,
connect. You have to draw that connection some way, somehow. And I mean, we've all had our parents at one point, or even then, like we've all loved and lost. We've all, there's emotions that we can all tap into that can get
right.
us into that character or into that storyline that we're looking for.
Right. We've all had losses. I mean,
Yeah.
you don't go through life without losses. And if you find someone who had perfect parents, let me know. I haven't found anyone
Yeah.
yet who had perfect parents. And, trauma is a word that sometimes is used more towards like physical abuse. It's not just abuse. Trauma can be just a look that feels off or that feels critical. And we've all experienced that. We experienced that as infants before we had words for it, as kids when we were just learning how to speak, as adolescents when we felt we had to speak in a certain way to be cool, and as an adults where we feel we have to play a certain role. But we've all been there, and it's universal. And to acknowledge that and connect on that level, even if it's within a fantasy figure.
So you mentioned you've had people who struggle with anxiety and depression. Do you often get people who had no idea that that's what they were feeling?
Yeah, actually, most of the time, when people come to me, they've identified it, or they wouldn't be coming to me. But there's another aspect, because part of my practice for over 30 years has been in the California workers' comp system. And there I'll see a lot of people who were injured at work. And it could be anything from, as I say, first responders to field workers to construction workers to someone sitting at a desk who just has carpal tunnel. And then they will file a stress claim, basically a claim of psychiatric injury because of their physical injury. And often you have to really lead that person to understand what their emotions are,
Mhm.
or it just gets translated into physical pain, or it gets translated into anger. So, particularly in that venue where it isn't someone saying, "Oh, I know I'm depressed," or "I know I'm anxious, I want to seek help," it's where I'm just hurting and I don't know what to do, or they turn to drugs or alcohol or other things, where you have to find a way to very compassionately help the person to understand what anxiety or depression is. And even if they never quite understand what it is, to recognize some of the symptoms that means that's what's going on, and maybe I should consider doing things somewhat differently.
Right. I mean, I asked that question because I was struggling with anxiety when I found out that that's what it was. I just remember struggling for one day. I was just driving around aimlessly around town, taking back roads, and just my mind was just in a fog. I just felt like something terrible was about to happen, but for no particular reason. Like I couldn't think of anything that was really stressing me out, but it was just this
Yeah.
feeling of panic and I'm going crazy, I'm losing my mind. And I remember I dropped off my kids with my mom, and I didn't know what to do. I felt like I'm losing my mind, and I don't want to tell anyone. I had this fear that if I admitted how I was feeling, that I felt like I was losing it, I'm going to lose my kids.
Yeah. With depression, sometimes it's easy to fall into that trap of feeling I'm going crazy. I don't want to let people know. With anxiety, and I'm talking very generally, of course, it's easy to go in a different direction where people see it as physical. Oh, it's my stomach. Oh, it's I'm feeling shaky, or I'm feeling that. It's easy to focus on the physical symptoms,
Yeah.
and then avoid really dealing with or even naming the emotion. And obviously, anxiety and depression often come together, and everybody's differently. But absolutely, and then it's a vicious cycle. With the more you fear what it means, the less you want to speak about it and find out.
Right.
Yeah,
Now that I think back, I know that what I had was postpartum depression. And now I know it. But back then, I didn't have a name for it. I just knew how I felt and that I had to hide it because I didn't want to appear
yeah,
weak as a mother. I didn't want to
yeah,
seem incapable.
yeah, yeah, yeah. And obviously, the paradox is that the more open you are to acknowledging that, and again, I don't mean you specifically,
Hmm.
anyone opening to acknowledging and getting treatment, the better parent you're going to be.
Right.
But that's the vicious cycle that we and our parents and our grandparents have all been caught up in for millennia.
Yeah. And the sad thing is that I wish that I had gotten help back then because there were years that I could go back and raise my kids all over again because I was in such a dark hole that I feel like I was not present mentally. I was not there for them. That's the irony of
I,
things.
I think that's a very important issue because it means being able to be open about that, but also not only looking back and saying, I regret it, and having a real grief about it, but having compassion for yourself. That, yeah, I did the best I could
Right.
with what I was taught, with how I grew up, with what society was telling me. I look at it now and I see where I screwed up, but I was doing the best I could. It wasn't out of cruelty.
Hmm.
If it was out of cruelty, then I need treatment in a different direction. But to be able to have compassion that, yeah, I was struggling, and when I was struggling, maybe I didn't make the best decisions. Maybe I wasn't the best parent, but that's life. And we can acknowledge it, we can apologize where necessary, we can grieve where necessary, but then evolve to a better place.
And she's doing a great job now, Doc. She's very aware of her emotions, and she's very aware of where she has grown as far as parenting. She's doing a great job. 2 16-year-old girls that are doing wonderful, and they're taking college classes. They're going to learn how to drive soon. She's a great mom to my daughter as well, who's 11 years old, about to be a teenager. So she's been doing great, and I think it's fun when we'll remind each other of how far we've come. Like we're really able to give each other that grace, look back, and also accept where we are and what it took to get here, because that wasn't easy either.
Right. I mean, that's basically exactly what I mean by saying having compassion for ourselves, for where we were, for the path we came on, and the fact that there's no way to predict the path. Sometimes we come to crossroads that we don't know which way to go, or we don't expect, or we don't even recognize till afterwards they were crossroads. And to be able to have compassion for what we had to deal with.
Yeah, thank you, Doc. Yeah, and we're talking with Dr. Reiss, psychiatrist extraordinaire, and we won't be taking too much of your time, Doc. A couple more questions. I did have this question here. Are there any warning signs or red flags that male wrestlers should be aware of when it comes to their mental health, and what steps can they take if they notice these signs in themselves or in their peers?
One of the things to watch for is when it starts affecting you physically and even subtly. We're talking about disruptions of sleep, disruptions of appetite. I've been talking about athletes, disruptions of motivation to work out. Things that that are normal in a lot of ways. Everyone has a bad night of sleep every now and then, and especially if you're traveling a lot. But if you start noticing a pattern of disruptions of sleep, appetite, concentration, focus, to say, well, are there really some emotions that are driving this? In terms of others, you can't be your friend's therapist. You need to have boundaries. But on the other hand, you can point out, hey, is there something going on, or is there something you want to talk about, or is there someone I can have you talk to, and to hopefully have the friend will be able to accept that, and if not, to just understand that unfortunately there are times all we can do is stand aside and watch tragedies unfold, where we can offer help, we can suggest help, but we can't force anyone. So, and to have compassion for that also, that at times people just don't have what it takes to seek help. And then we want to try to guide them and guide them to other people who may be able to help them, like in substance abuse, it may be AA or organizations like that, which aren't as clinically oriented, but to also acknowledge that you can't force someone to get help if they're dead set against it.
Do you have any advice for anybody who's hesitant about seeking help?
Yeah. I think the best advice is don't feel you have to be pressured to work with the first person you see, or to accept the view of or diagnosis of the first person you see. Shop around. And if you feel you don't make a good connection with a therapist, just try someone else. Get a second opinion. Don't feel you have to make a commitment. And again, to be not all that facetious, I say, if I had to go in for surgery, I really wouldn't give a damn what the surgeon's personality was like. I just want him to do a good job, or her. On the other hand, if I want to go into therapy, there has to be a connection.
Mm-hmm.
There has to be a human connection. So don't feel that you have to be pressured to accept one particular point of view or one particular diagnosis or one particular treatment plan. Shop around and be careful, because there's a lot of snake oil out there.
Gotcha.
So be reasonably cynical, and in that be assertive to say, if I feel this isn't right for me, then maybe it isn't right for me. And if your therapist or psychiatrist takes offense at being questioned, you got the wrong therapist or psychiatrist.
Gotcha. Yeah. Okay. And so, Doc, are there any resources or support networks available specifically for male wrestlers who are struggling with mental health?
I don't know. Well, there certainly are. Right now, there's more in terms of physical injuries and especially concussions.
Yeah.
You have a lot of good resources out there. In terms of straight mental health, I don't think we're there yet. There are some, and I'm sure there are plenty that I don't know about. But as a overall, there's not enough.
Yeah,
there's not enough. So just it depends where you are. It depends what organizations you're with. Some organizations are providing mental health care. Some organizations still look the other way. But look around, and be careful on the internet, because some of what's out there is very legitimate, and some of it is a bit screwy.
That's the problem with today's society, is we see it on the internet and we take it as the gospel.
Right. And you got to be careful with that. So, feel comfortable being appropriately cynical, and, what I tell people is there are no bad questions. I may not always have a good answer, but there are no bad questions. And whether you're dealing with someone on the internet or in person, if they're reluctant to take your questions, it's probably not a good therapist.
Gotcha. Okay. That's good to know. And, I really like what you mentioned earlier, that doing this is a great way to help. And that's basically what we've wanted to do. When we started this podcast, we did dive into the vulnerability factor of me being a wrestler, coming on the show and talking about things in a vulnerable way and opening up in such a way that others may not have seen from me on a personal level, when we see each other in person, or even if we were booked on the same show and things like that. And I really do feel strongly about opening the doors to conversation, and that's not just to my friends, but anybody who's listening in to, send us a DM if you have any questions or any suggestions, or let us know how you like this episode, for sure, because this is something different that we've never had somebody who's not in the same room as us on the show with us. So thanks to Dr. Reiss for being on the show with us today. Mel, do you have any questions? Last questions for Dr. Reiss before we...
Man, I didn't think I would cry today. But I'll just, like you mentioned, just sharing our stories, our own struggles. I think it is so important. I think that's something that I'm trying to be mindful of now, that's kind of how I can make up for how I felt then. It's give grace to who I was then and grace for who I am now, and just not attach any shame to where I've been. And that comes just by sharing my story.
Yeah. And let me just add, if anyone contacts you and has a question for me, feel free to forward it to me, or even connect me with people. I mean, obviously my time isn't totally unlimited, but I would not charge for that. If someone wants to ask a question or just make contact, please feel free to forward that to me.
Okay, great. Yeah. And so Dr. Reiss, he took the time to be with us today from San Diego all the way down here to Wesco, Texas. We were able to connect. Dr. Reiss, thank you so much for joining us today. It's been a wonderful time catching up, and I'm really glad you got to meet my wife and that you guys got to chat too.
I hope we can do this again.
You're very welcome, and thank you for having me, but more than that, thank you for what you're doing.
Oh, thank you so much.
Thank you, Doc. So we'll go ahead and say our goodbyes. You know what? Before we do that, we always, on the show, Doc, we always ask everybody to, at least at the end of the show, do a toast to anyone or anything that you're grateful for, anything you want to bring attention to. The floor is yours.
Well, I will toast with my coffee. It's a little too late for coffee, but I will toast to my coffee, basically to compassion. Mm-hmm. I think that's what's missing most in our society right now. And I think we've heard a lot of compassion today. Toast to compassion.
Cheers.
Salud. Thank you, Doc. And ladies and gentlemen, listeners of Lucha por Lucha, we hope that you enjoyed this episode. Something different, something new, and who knows, maybe we'll have Dr. Reiss back on the show one of these days. We'll be in touch. All right, so thanks a lot, folks.